Long COVID, a prolonged challenge post-acute COVID-19 syndrome emerges when symptoms persist or reappear more than 3 months after the initial infection, with no other identifiable cause. This condition can affect individuals regardless of the severity of their initial illness. While early research has highlighted neurological complications during the acute phase of the illness, understanding the long-term cognitive consequences of long COVID remains an evolving area of study. Dr. Nurugiyen, Dr. Agnes Perez Villan, and Dr. Raquel Sanchez Valle, authors of the study, expressed their motivation for investigating cognitive symptoms post-COVID-19. Working in the cognitive unit of a neurology department, they encountered numerous patients reporting cognitive issues following COVID-19 infection. This prompted their investigation into the duration and specific cognitive domains affected, as well as any associated changes in neuroimaging or fluid biomarkers. Study methodology and findings. The study enrolled 53 participants who were referred to the Alzheimer's disease and other cognitive disorders unit at Hospital Clínic de Barcelona between March and November 2021. These participants met specific criteria, including a confirmed COVID-19 diagnosis, cognitive symptoms persisting for at least 8 weeks after the onset of COVID-19 symptoms, fluency in Spanish, and absence of pre-existing neurological or psychiatric conditions that could affect cognitive performance. Participants underwent rigorous neuropsychological assessments at multiple time points, baseline, 1 month, 3 months, and 6 months post-infection. These assessments covered various cognitive domains such as verbal and visual memory, language, attention, visuospatial abilities, and executive functions. Additionally, participants completed questionnaires assessing their mental health status, including levels of depression, anxiety, apathy, fatigue, and overall perceived health. Cognitive and mental health implications. The findings revealed that 75% of participants exhibited cognitive impairments, with executive functions and verbal memory being the most prominently affected domains. Mental health issues were also prevalent, with significant proportions of participants experiencing moderate to severe depression 19, anxiety 57, apathy 64, and fatigue 35.4. Quality of life assessments consistently indicated a diminished perceived health status across all measure domains. Over the 6-month follow-up period, cognitive test scores generally remained stable, except for improvements noted in verbal memory. The proportion of participants with normal cognitive evaluations increased from 24 at baseline to 50 at the 6-month assessment. However, there were no significant changes observed in mental health symptoms such as anxiety, apathy, and fatigue over time. Neuroimaging and biomarker insights. Neuroimaging studies using MRI revealed correlations between cognitive impairments and specific changes in brain structure. For instance, visual memory scores showed positive correlations with gray matter volumes in various brain regions. Conversely, reductions in gray matter volume were observed in areas such as the hippocampus and thalamus, although no significant longitudinal changes in overall brain structures were detected. Biochemical analyses of fluid biomarkers did not indicate significant differences in neurofilament light or glial fibrillary acidic protein levels between post-acute COVID-19 syndrome patients and controls. However, variations in cytokine levels were observed, with some elevated and others reduced in long COVID patients, albeit within normal limits and showing no significant changes over time. Study limitations and future directions. The study acknowledges several limitations, including a relatively small sample size and the absence of cognitive assessments prior to COVID-19 infection. Additionally, the lack of healthy controls or individuals with COVID-19 who did not report cognitive symptoms limits comparative analyses. The study's short follow-up duration and single-center design also constrain the generalizability of its findings. Future research endeavors should aim to address these limitations by including larger and more diverse participant cohorts, conducting longer-term follow-ups, and incorporating functional neuroimaging techniques to elucidate underlying neural mechanisms. Exploring potential mechanisms such as persistent inflammation or immune dysregulation could provide valuable insights into the pathophysiology of long COVID and its cognitive sequelae. In conclusion, the study underscores the enduring cognitive impairments and mental health challenges faced by individuals with post-acute COVID-19 syndrome. While cognitive function, particularly verbal memory, may show slight improvement over time, the persistence of debilitating symptoms like anxiety, apathy, and fatigue highlights the multifaceted impact of long COVID on patients' overall well-being. Continued research efforts are crucial to further unravel the complexities of this syndrome and develop targeted interventions to support affected individuals in their recovery journey.